We can now bring in Avril Benoît, Executive Director of Doctors Without Borders USA. Thank you so much for joining us on the program today. Now, since Donald Trump has come into office, we have seen, of course, the Department of Government Efficiency in action making deep cuts to things like USAID. How has that affected your work at Doctors Without Borders in the US?
Well, around the world, Doctors Without Borders, or as we're known internationally, Médecins Sans Frontières, or MSF, we're not funded at all by the U.S. government, so we're not directly affected. But we're indirectly affected, and it comes in the form of the cuts to ministries of health, so the bilateral funding that the U.S. government would have offered. It comes in the form of some of the subsidies and grants that were going to local health organizations and international non-governmental humanitarian organizations who have now had to close, have withdrawn from areas of great need. We are seeing this as a human-made disaster that will have dire consequences for people's health around the world.
Can you give me a concrete example of a project that has been impacted in the US, for instance?
Well, we don't do operations in the United States. We're an international humanitarian organization working mostly in crisis zones, in instances of outbreaks, instances of failed states where perhaps the health systems have collapsed. So we're there as a support to the national and local health providers. I can give you one example, Sudan. So you've got a war, a conflict that has been going on now for a couple of years, 11 million people displaced. And in parts of Sudan, you have community kitchens that were funded by USAID. As a consequence of them no longer having funding, you have a much higher likelihood of malnutrition. And already we know that in Sudan, the malnutrition rates are absolutely shocking. We have cuts to some of the HIV/AIDS support programs through the PEPFAR program. We have cuts to programs that were providing safe drinking water for people in Port-au-Prince and in Haiti, where so many are displaced by the violence between the gangs and the police. So around the world, we have instances and examples of places where some of the services, the life-saving services that had been available to people that even we relied on as healthcare providers in partnership with others, those services have been withdrawn. And so it's a much greater burden then on those who remain behind, including the ministries of health, the departments of health, the public health workers who are trying to struggle now without all those partnerships that often made their work possible to save lives.
You mentioned how you are indirectly affected by those cuts that have come to USAID and the budgets that have essentially been scrapped. Have you been forced? Has Doctors Without Borders been forced to let go of staff or cut some projects?
Well, it's quite the opposite. Because we're privately funded by millions of supporters around the world, we're still on the ground. And what we're experiencing is an increase in need, an increase in needs that we feel compelled to respond to with the means that we already have, thanks to the generosity of private donors. But we're deeply concerned about this man-made disaster in terms of the cuts to U.S. government funding, because we can see the impacts in terms of those referral hospitals, the arrangements that we often had with other organizations. Just think of water and sanitation as a basic thing. When you have organizations that were funded by the U.S. government that were providing safe drinking water and perhaps doing interventions for cholera, perhaps oral reach hydration points or early intervention health posts around the communities, when those are gone, somebody who has cholera will have to travel a much further distance to reach perhaps the cholera treatment center that we're running. And so that puts a burden on us then to see what can we do to address the water and sanitation issues and do some of the prevention activities without all the supports of the whole infrastructure that was made possible to other organizations and the ministries of health. So in our case, what we're worried about is a 30% increase in patients in some of our clinics and hospitals. We're worried about increasing pressures on our supplies, which cost all the more in our projections because of the tariff wars that are looming. We have certainly a lot of concerns about the need to intervene in places where others are withdrawing, and that includes places like Sudan. It includes places like Ethiopia, South Sudan, Democratic Republic of Congo. In DRC, you had the U.S. government was funding 70% of the humanitarian response in the East. So you can imagine that these cuts are devastating. And for those who remain behind, like Doctors Without Borders, it's a burden. It becomes an ethical question. How much more can we do with the means that we still currently have?